Imagine that you're dealing with a health issue with yourself or maybe a loved one, and that's trying enough, and it's serious enough that you have to go to another country right now for healthcare. That, of course, would be very challenging, but imagine once you get back, the government piles on with all kinds of fines and problems, and they make things a lot more difficult than it needs to be. Today, we're going to chat with Amber Mealing, who's from London, Ontario, who's going to tell us about her story. Amber, thanks for taking some time today to chat with me.
Thank you. Thanks for having me.
So, Amber, why don't we start off at the top? If you want to tell us, because the story surrounds your son's health, could you tell us a little bit about your son and why it was that you decided to go abroad for healthcare?
Sure. He was born with a few challenges from day one. He's been a trooper for sure. He was not only born with a lateral cleft that he had repaired at 18 months here in London, but he also was born with microtia and atresia. Microtia is the outer ear deformity, and atresia is the lack of or issue with the ear canal for lack of sound. What we left, and actually we're looking for recently and found this option in the States that is not available in Canada, was for his microtia. It was reconstruction that we were, researching over the last couple of years that has no longer been done, and only rib cartilage is available. Rib cartilage repair is available in Canada, which is not available until they're about 7 or 10 years old, when they harvest the rib cartilage. But obviously the child has to have a significant or enough to make it an option. Mm-hmm. But our son was really, we're noticing him being really stressed about his ear, which is quite sad when he's only 4 years old, which is why we started looking at options now. And to be honest, really, we found the more research we did, the more this seemed like a feasible and the best possible solution for him, both now and long term.
And so as a young guy, I believe you said he was 4.5, is that right?
Yeah, he'll be 5 in July.
So taking his rib cartilage, I imagine that's a pretty invasive procedure for a young boy to go through, isn't it? How does that compare to the procedure in the US that you were able to line up?
Well, from what we understand, it's a much more painful procedure and a much longer recovery. So obviously we're happy to hear that even with a skin graft, very minimal, very minimal pain. But 10 hours of surgery, and he went home with us that night and was more himself every day. But like almost back to his full speed by day 3.
Oh, wow. Well, that's good to hear that he's doing well. Your husband is still in the United States with your son, is that correct?
Yes. So they needed to have, especially with us being international, it's not something we can go back and forth for. Like, we need to go back to Toronto or London for post-ops. So they needed to stay in the area or in the country for 3 post-ops. I believe 4 post-ops. So they needed to stay in the country and make sure, I would imagine there'd be complications with travel, with, cabin pressure and everything, with everything that he's been through. So he needed to be discharged from Dr. Lewin's service before he came home. So my husband had to stay there, take more time off of work, which I wasn't able to do. I was lucky enough to be able to take 2 weeks off to at least be there for the surgery. So yes, he and my husband are still there, and they hope to have their final post-op on the 28th and come home hopefully May 1st or within a couple of days.
And I want to ask you in a minute about the challenges that you faced once you got back to Canada, but just listening to your story, the whole experience trip, it sounds like it would have been quite costly, right? Between the surgery, your husband's had to stay afterwards with your son for several weeks. Obviously flights, all of the whole thing, it's pretty expensive. Did the government give, they're not offering the procedure that you felt that your son needed. Did they provide any support financially at all for helping you?
No, no, unfortunately, it's not covered by OHIP. We actually know of a couple of families that have gone through, if not the same procedure with the same doctor, but something very similar, and both of which have been denied by OHIP. We haven't heard back yet. But yeah, from what I understand and what we've been told, it's not covered under OHIP. So we've had to raise the funds ourselves.
And is that, what was your reaction when you heard that? Like, are you when we speak with people, quite often we hear that when they have to go abroad, many times they're frustrated because they pay a lot in taxes. They expect the healthcare system to be there for them. In this case, the procedure that they wanted your 4.5-year-old son to have is pretty invasive, as you described, having to, take his rib cartilage. Was it frustrating that they wouldn't at least provide some support to get the procedure done elsewhere?
It was definitely disappointing for sure, especially when knowing all the other costs that will incur with travel and time off of work, which will be unpaid, and definitely not ideal. But when it comes to your son approaching you at 4 years old, being upset and wanting his ear done and actually asking you himself, you do what you need to do.
Yeah. No, I've heard that from a lot of people. Now I've mentioned to you before we started this conversation, but we've talked to a lot of people about medical tourism, and the claim is always that the rich are going abroad, but there's a lot of middle class Canadians that they do what they have to do, whether it's for a son or a mom or a dad. They do what they can to get the care they needed. I want to switch now sort of to your return to Canada. So your husband is still there with your son. You have come back to Canada. Could you tell us a bit about what happened when you got back on Canadian soil?
Yeah, it was, I think obviously with everything you're hearing on social media or nothing you're hearing on social media, and it doesn't matter how much you try and do your research to be prepared, there's really no black and white or cut and dry answers on how to prepare. So it was nerve-wracking for sure. We went and had all the documentation we possibly could think of between time off of work and any letters from both his doctor here that he was aware that he was going there and it was the option that wasn't here, and all the medical documentation of Dr. Lewin, who did the ear surgery, and how long we'd have to be there. We feel like we did everything we needed to do and were asked to do, including COVID tests on the way there, when we were down there, and on the way back to get back on the plane. But it was nerve-wracking and very stressful to, you feel like a criminal when you're coming home, because it not only do you feel no support, but there's really no one there to even, you don't feel welcomed home is how 100% I felt.
So you feel like you're treated with I'll say scorn for returning home during the pandemic. You weren't on a beach in Mexico drinking pina coladas. You were there obviously abroad for a serious health medical procedure that you felt that you needed for the best to provide the best care for your son. What happened when you got to the border? So you had your COVID test. For a while, the government was saying you have to, if you're going to come into Canada, you need the COVID test, and it has to show that you don't have COVID-19, then you can come in the country. So you had that, you had all your medical paperwork lined up. What was the response at the border?
So when we checked in, with Delta on the other end, in California, they tell me to download an app or go onto a website called ArriveCan. It was something that you needed to put all of your information in, your passport, where you've been, where you're going, where you're quarantining. And I thought, well, this is great. Like I won't, this will really help. It was a little nerve wracking because everyone keeps telling you, don't sign anything, don't do anything if you're not aware of it or you're not sure what the outcome is going to be. And it did have an option of saying, are you exempt? And so to be honest, I didn't know if I was exempt or not. They did say that it was, necessary or travel that was allowed. So I went up and asked the agent, and she said, to be honest, I think it's exempt, but you'll have to ask the customs agent because I don't know the answer to that. So wait till you get to the customs agent and she can help you out with that. It even actually says right on the that part of the check-in process, consult your customs agent. She will give you a code if you are exempt, and if not, you will continue on with the process of the form. So I did. I waited. She was quite rude, and she said, why would you feel you were exempt? And I said, well, because right here it says for medical reasons or medical transport, for exemption. And she said, no, that's for people that are traveling for medical reasons for work, or whether it was, organ transportation or what have you. And she said, no, you need to fill that out for, and this should have been, she was very rude and said, this should have been filled out before you even got here. And I said, well, I'm sorry. I was told otherwise. Do you want me to do that here or there? And she just said, here, just do it here. So I asked her and finished that off. And I said, do you need to see my documentation about, the time I have off work or whatever? She said, no, I want to know what hotel you're, or have you arranged your hotel? And I said, no, I don't need a hotel. My car's right out front, which I spent extra money to make sure that was there for me. So I didn't have to deal with any transportation when I'm supposed to be quarantining. And there's no one at my house right now and no reason for me to use the hotel. And so she did a few circles and punched my my passport and then said, you're going to baggage claim. So gave me my declaration and off I went.
And so I think you'd mentioned that at one point they gave you some fines because you weren't going to the hotel. How did that come about?
So right after you hand over your declaration off the out of the baggage claim, they kind of shoo you into this other room to the left, and there's some taped off areas that you kind of have to go through the ropes. And I was one of two people in there at the time. There was another lady that was coming in after me, and these young girls behind the counter, probably maybe around college age, asked, do I have my hotel booked and do I need help booking it? And I said, no, I'm going home. I'm by myself and I'm going to quarantine. I have 2 weeks off of work. She's like, well, unfortunately you need to book a hotel. And I said, well, I'm not doing that. There's no reason for me. I have my COVID test, my negative COVID test, and I have a place to quarantine safely and legally. And she said, well, unfortunately, if you are refusing, there will be a fine. And I said, if that's what needs to happen, then it is what it is. And then she said, well, we need you to do another COVID test. And I said, well, I'm not sure why I need another COVID test because I have a COVID test, PCR COVID test with results here to get on the plane that I had 36 hours ago, which I paid $220 US for, to make sure it was in with the 72-hour window. And she said, well, unfortunately, if you're refusing that, we need to give you another fine. So not only did I get a fine for the hotel for $3,755, but also a fine for refusing the COVID test, which was another $1,880.
So over $5,000 in fines.
Yes.
I imagine that's a tough pill for your household to swallow. I don't think too many families could suddenly be faced with a $5,000 bill on top of all the other costs that you've incurred to to do this trip.
Right. Yeah. It was not a good feeling.
Yeah. So I guess one of the things I've observed, and I haven't had to pay as close of attention to the rules as you have, because you were actually going abroad for an important um, medical reason, but the rules have changed over time. The rules have
Mhm.
constantly been changing throughout COVID. One minute you can do one thing, the next minute you can't. I mean, the Ontario government in the span of 24 hours recently said, oh, you can't go to playgrounds. And then they said, you can go, it's okay. The science has changed.
Yeah.
You're safe to go to playgrounds or whatever. At one point, you needed this test before you could get on a plane to come into Canada that showed, hey, I was tested for COVID. I don't have it. You went through that. You went online. You did the best of your ability to, by the sounds of it, to make sure that you were following all the rules. You know, you filled out the app, tried to get everything settled, and they're still trying to shoo you into a government hotel for a few days when you've got, like you say, your car is there, you're going straight home, you've got plans to stay in your house for 2 weeks in quarantine. What's your take on this?
It's upsetting and frustrating and stressful, especially since I just had to leave my, sorry,
Yeah.
I had to leave my family and my son in the States when he's in a very vulnerable state. My husband has no support,
Mm-hmm.
and our little guy is amazing, but he's a handful. We call him Hurricane Husband for a reason, and he's a lot. So not being there to help my husband and not be there for my son has been really hard.
Well,
And to come home and feel that we've crossed our T's and dotted our I's, um and still are being treated like criminals for
mhm.
something that we wanted to better our son for. If it was available in Canada, we would have 100% done it and not put him or anyone else through all of this. But it was the best thing for our son.
And we talked right at the beginning, you work in the healthcare field. Um,
Yes.
I'm going to go out on a limb and suggest that you probably wouldn't have done any of this if you thought that you were putting healthcare workers at risk.
No.
You had your plan, you did the test,
Yeah.
I'm guessing you wore a mask on the plane and stuck to
Yep.
yourself and whatever. And
Even our 4-year-old son had to wear a mask the entire time. So yes, we played by the rules, and the rules keep changing. So
what would you say? I mean, like, what do you think is a reasonable alternative? On the one hand, the government is trying to make sure that people aren't coming into the country with this virus. So that we just heard recently that they're shutting down flights from India because there's been a huge incidence there. Finally, they're shutting those flights down, right? But yet, you're coming from the US where they've actually got more people vaccinated than we do.
right.
What do you think is sort of the balance there that the government didn't strike? What would you see as sort of a reasonable approach to this?
I found it really frustrating to know that obviously there's people that still have to travel for work, and those people are, from what I understand and what I overheard at the airport, are not having to quarantine. What if you're doing everything they're asking you to do? I don't feel the quarantine, or at least the treatment we got, was necessary. I
Mhm.
don't know what the answer is. I don't know. It's unfortunately everyone has a different opinion, but trying to make you appreciate Canada and the ability to have options. That doesn't feel like there is any right now, and that's the heartbreaking thing that I think everybody's going through, not just in this situation, but every aspect of it. There are no options. And I don't know, it's not a good feeling to have. It doesn't feel like freedom when that's the case.
Mhm. And as we talked about, you weren't on the beach sipping pina coladas. This is a pretty serious trip. I'm sure you wouldn't have made it if you didn't feel it was necessary. It's not like someone
No.
going abroad to go golfing or something like that. And that,
Yeah.
we can certainly debate that, whether or not the rights should be infringed upon or not. But I think it's sort of, you are in that category where if anyone's going to be checking that box for exempt, it would be for a serious medical reason. Is there anything that we haven't touched on that you would like to bring up that you think viewers might want to know about?
I mean, it was a very unpleasant experience on the other end coming back into Canada, but
Hmm.
I will say our experience in California and with this doctor was amazing, top notch, and warm and comforting and above and beyond. By no means do we regret doing any of this, and it will all be worth it in the end. I just really hope that because of we can maybe have an awareness and help other people that won't have to go through this.
Mhm.
And also, I mean, my concern right now is my husband and my son getting home, and I hope that they don't have to go through any of the things that we did, because my husband has enough to worry about, and getting my son home safely.
Yeah. And just on that note, when they were trying to usher you into one of the quarantine hotels, or push you towards that option, did they tell you how much that would cost? I've heard the figure of about $2,000. Did they give you any ideas to what it would cost?
No, I've heard that it could be up to $3,000, and you could stay between 3 days and 14 days. I've heard they transport you to whatever hotel. But yeah, it was not a fun feeling, and obviously my comfort level would have been back at my own home. So I'm very thankful that I was able to do that
Mhm.
in the long run after a lot of drama and stress.
Yeah. Well, I do want to thank you for being willing to talk about this. We've been trying to research sort of the side effects from government decisions during COVID, because I think there's sort of a very narrow lens that governments are looking at the situation right now. They're looking at COVID patients, and they're not thinking about always, I think, other patients that are affected in the healthcare system, other people that are affected in adverse ways by the various measures that governments have taken. So obviously your story is important too. I think for people to understand what the implications are of some of these decisions beyond simply affecting COVID people. So thank you very much for taking a few minutes to chat with me today. And every once in a while, we do a chat like this, and afterwards someone says, oh, could you put me in touch with that person? If someone does want to reach out to you, are you okay if I share your contact information and help facilitate that?
Absolutely. It would be amazing if I had that opportunity, and I would be happy to help someone else, even have a little bit of a heads up. Yeah, absolutely.
Okay, great. Well, listen, thanks a lot. And I hope
Thank
your
you.
son does better. Hope he gets well soon after his surgery and continues to improve. And I hope your son and your husband have a safe trip back to Canada.
Thank you. I had an amazing video conference with him last night, and he is very happily showing off his new ear and is already proud of it. So it's pretty heartwarming to see.
Well, that's great to hear. Thank you very much, Amber.
Thank you. Thank you for your time. Take care.
Bye-bye.